My name's Skiles. I'm working at the Social Neuroscience and Psychotherapy Lab at the Portland VA. So I'm trained as a psychologist. I help out with preparation sessions, dosing sessions, and integration sessions for veterans moving through our trials of psilocybin therapy as well as group MDMA therapy. So I joined the Marine Corps because I had dropped out of high school actually when I was 16. The year was 2000 when I joined, so Bill Clinton was president. It was pre 9/11. There was no real war in sight. I think 6 months after Marine Corps boot camp, went through School of Infantry training and became a motor vehicle operator, a driver. And then 9/11 happened not much longer after that while I was stationed in Okinawa, Japan. The whole world kind of changed. And I was actually in a unit at the time that had the highest suicide rate. It was under investigation for having one of the highest suicide rates in the armed forces. And one of my friends was from Schenectady, New York, and was more experienced than I was, and found that out on town in Okinawa, Japan, psilocybin was legal. Yeah, and I had my first mystical experience in a barracks room in Okinawa, and it's like an 18, 19-year-old kid. There's no real framework. I didn't really appreciate the decrease in depression symptoms, your appetite for life and food in general just came back, and slowly but surely we really bonded as a unit, and to this day we're still very much in connection with each other after moving through some really challenging experiences and also having some meaningful experiences with psilocybin together. So when I returned home, there was a lot of disassociative episodes in my life, as well as flashbacks on a daily experience and a lot of paranoia at the time. I was actually starting some inpatient programs at the VA while I was in a doctoral program for clinical psychology that specifically looked at TBI, PTSD, and chronic pain for Iraq and Afghanistan veterans. And the program was doing pretty well. It started garnering some attention from the U.S. Special Forces community. The Sana Symposium is a training program for licensed medical professionals who are interested in psychedelic-assisted therapy and science and research. What I hope that some trainees are able to walk away with is the importance of doing your own work and experiencing psychedelic-assisted therapies in order to understand the orientation that clients or participants will be going through and how to help them and support their experience.